them how to wear their shoes, like telling them, I'm not saying that you can't wear your shoes, you love your shoes, but we have other patterns that we can utilize for them to wear these shoes. This is the conservative aspect of it. So, which can include like silicone thing that we can put on around the toe in the shoes to keep the shoes more comfortable. Or I tell them, if you're getting shoes, make sure that the shoes have a little bit of soft interface inside so that there is not a lot of friction and to allow you. And then I also teach the women who are wearing these design shoes to try to get maybe like half size, little bigger, so that they don't have all the toes bunched up at the front and they're leaving some space, so that I put cottons or some, like a little cushion in the front to take that pressure off, and therefore your toes will be a little bit free and you're not having them bunched up. And then we come to the surgical treatment. So as we said, it depends on what type of comatose we're dealing with. Are we dealing with a more flexible one versus a rigid one, which is stiff and is not budging? There is no movement at the joint. So if it is just a flexible one, we can do the tenotomy like I explained earlier, and we can do arthroplasty, as Dr. Satora said it earlier, which is taking the joint off and making it flatter, and therefore that's easier. And then we can do also what we call arthrodesis, fusing the whole joint. And sometimes we do that, which I did also research when we were in residency program. We can put implants in the area to mimic the curvature, right? The curvature to allow you to still have that little bend, is not standing, sticking up, straight up, because sometimes the toe can deviate in different position if you're not trying to have a good fixation. So we can also do that. And these are some of the options that I give to my patients.